50 and beyond. Aging gracefully.
Medications are an important part of medical care for older adults. Without medications, many aging adults will function less well or die at an earlier age. Some drugs that we take for granted when we have headaches, stomach pains, body aches, or sleeplessness can land you in big trouble. There are drugs that can be taken for cold, cough, and fever to get some initial relief. But there are some medications which should not be taken without a doctor's consent. The dictionary describes self-medication as the use of unprescribed drugs to treat a disease. That means the drugs were not prescribed by a doctor after proper diagnosis. Self-medication can also be defined as using an unprescribed drug, recharging the previously prescribed drug, prescribing a drug for friends and relatives, taking medications remaining from previous prescriptions, and also changing the dose of medications. I hope that's clear. Self-medication also can be defined to include the use of industrial, traditional home remedies or supplements, which may cause important complications such as bacterial resistance, drug interactions, severe side effects, drug dependence, intentional and unintentional poisoning, and even death and undesirable health outcomes. Doing self-medication is just complicating things. Self-medication also includes the treatment of common health problems on the advice of a pharmacist or nurse without professional diagnosis. Research has shown that older adults are the frequent practitioners of self-medication, and this is because they have higher risk of getting many diseases at older age. Aging adults take more medications than other age groups to help them live a comfortable life. Chronic conditions such as diabetes, arthritis, and heart disease may result in combined prescriptions, leading to higher exposure to addictive drugs. Let me share these worrisome statistics with you. 77% of adults aged 50 and above misuse prescription medicines such as painkillers, sleeping pills, and sedatives. Welcome again to my channel 50 and beyond, both returning and new viewers. Thanks for stopping by. Please subscribe if you have not, like the video, leave a comment, and share this video with everyone that you care about. I am Jumoke Michaels and I am 53 years old. In Nigeria as well as other African countries, medications are easily accessible with or without a prescription, which raises the risk of abuse and the emergence of unintended occurrences. For aging adults, self-medication is more dangerous as compared to other age groups because of changes in their organ functions that occur due to aging. Causes of self-medication could be due to lack of access to healthcare, easy availability of over-the-counter drugs in markets, and poor drug regulation practices. Other causes are ignorance, poverty, lack of time, high consultancy fees in hospitals, fear of going through several tests, laziness, wrong education, long queues in hospitals, and non-availability of healthcare. You need to know that self-medication gives only temporary relief to sickness instead of permanent cure, thereby delaying diagnosis. You will only succeed at suppressing the signs and symptoms of sicknesses which still relapses after some time. Now let's look at problems of self-medication to aging adults. Number 1 is problems of under or overdosage with their attendant problems of treatment failure and development of drug-resistant strains. It leads to destruction of certain body organs such as the liver. It can cause low blood pressure, constipation, dry mouth, and cause you to fall. 3. Problem of drug addiction, especially when it's taken on a long-term basis. 4. Inability of your aging body to break down or remove medications from your system, meaning that the medication can then stay in your body longer than needed. 5. There's probability that your condition will get worse. It will cause side effects or that it may interact with other medicines. This is very high, making them less safe or ineffective. 6. Development of additional mental health issues can occur, which can then change the brain structure and function after some time. 7. Because you believe you are fixing the problem, self-medication will prevent you from seeking and getting the right help that you need. That is very dangerous. 8. It can lead to unexplained death. For example, taking paracetamol when you don't know you have liver problems will kill you. What we're looking at next are the effects of practicing self-medication in older years. 1. It can lead to increased risk of unfavorable health outcomes, and this gets worse with increased age. 2. Increased feelings of depression, hopelessness, anxiety, and stress. How then do you stop self-medication? 1. Go to the hospital. See a doctor who will recommend tests and prescribe drugs. Obey all of your doctor's instructions. 2. Choose healthier ways of coping with your health, including taking long walks, eat right, more of fruits and vegetables, sleep well, change your beliefs and thought patterns about self-medication. 3. Be more social and don't live an isolated life. Ask for help if and when you need it. 4. Pharmacies should stop giving medicines to people based on old prescriptions. In conclusion, medical experts always say that some medications may no longer be appropriate for you like they used to be. So see your doctor to review your medications frequently to make safer choices. Never stop or change your medications without talking to your doctor first. Please, let us all be intentional about our health and well-being as we age. Please, so like I always do, please don't leave without subscribing to this channel, 50 and Beyond. Like the video, leave a comment in the box, and share this video with all your loved ones, especially those who are guilty of self-medication. They need to see this video. Thank you for watching. I am Jumoke Michaels. Keep aging gracefully. Bye-bye.